Joining me today is Shannon Terek. Shannon's a 2017 graduate of Washington College with a BS in biology and an area of emphasis in biochemistry. Shannon, thanks for taking the time to speak with me. How are you?
I'm good. How are you guys today?
Doing well, doing well. We've got the little, I guess, one last gasp of warmer weather, right? At least here. I don't know, everybody's all over the place constantly now, right? So,
hmm
um, Shannon, can you tell us about the graduate program you're currently in?
Sure. So I'm a second year genetic counseling student at Long Island University. So I joined this program last year. Um, I took 2 years off in between graduating from WAC and applying. So I did some research with ALS and genetics before jumping into this program. But like I said, I'm in my second year now with genetic counseling, and I will be graduating hopefully here in May. But currently I'm doing my internship part of the program.
And can you tell us a little bit more about that internship?
Sure. So the way these programs work generally across the board with genetic counseling is that your first year of your genetic counseling program is more course heavy. So really focusing on backgrounds of genetics, genetic knowledge, and also like psychosocial skills and whatnot. And then your second year is more towards your internship. So I am currently finishing up my prenatal internship at New Jersey Perinatal Associates. So working with high risk pregnancies, offering testing options to pregnant women, talking about those results, things along those lines. And then in December, I just found out I am working with pediatric and oncology for my next internship. So I'm working with one of the local children's hospitals up here in Long Island.
Okay. And I think you pulled back the curtain a little on the next question. A lot of people watching this probably aren't that familiar with exactly what a genetic counselor does. Can you fill us in?
Yeah, and that's totally understandable. I know when I first mentioned I wanted to get into this career, a lot of people looked at me like I was crazy, like I made up some random career, but it is a relatively new career. I think there's about 5,000 genetic counselors in the country. So just a little background on the career in general. Genetic counselors are trained in medical genetics and counseling skills. So our goal is to really help patients interpret test results, consider different forms of genetic testing, and then off of that, guide them and support them in understanding those results, what that means for them personally, and also what it means for their family. So with genetics, there's a huge amount of family implications when it comes to testing and results. So just really helping patients understand what it means to get testing, what those results mean for them and their family, and being a counselor for them the entire way.
Sure. And so you mentioned there's probably about 5,000 genetic counselors now. Is that something is that a rapidly growing field?
It is. So just within the past few years, there's been more and more programs popping up. So with that, more and more genetic counselors are joining the workforce. Like I said, probably the boom happened within the last 5 years or so, but we're continuing to grow and develop as a field. It's a great field to get into personally. I might be a little biased, but so many new opportunities are popping up. I know when the field first started, the main focuses were cancer, pediatric, prenatal, but now there's openings in neurology, blood disorders, immune system disorders. So basically any field of medicine, you can be a genetic counselor in.
So tell me personally, you said, so I guess it said, I guess it sounds like you knew a little bit about this field before, some others that you might have spoke with. So what sparked that interest?
So I'm from a small town in Pennsylvania, and I remember back in middle school, like just job researching, looking up fields, and just taking my first genetic class in general, I stumbled across this field, and I remember telling my parents like, "Oh, I want to be a genetic counselor," and they looked at me like I was crazy because just this field's so new, they didn't really know much about it. So I know in undergrad, I was really leaning towards pre-med. I took all the pre-med classes, recommendations, everything along those lines. But when I got to my genetics class my senior year, it really just ignited that love I had of genetics in the past. So that's one of the reasons I did end up taking 2 years off after graduating, just because I wanted to reevaluate things. I did genetics research and I looked back into the field, looked at the schools that offered this program, job openings, things along those lines. And I realized this was truly the fit for me. So I did my own research, talked to a few genetic counselors out in the field to gain a better understanding about what it was to be a genetic counselor. And then I ended up applying and getting in. So it ended up working out. It was a process, but it did work out for the better.
And so the courses you took when you had sort of been leaning toward the pre-med track, were those a lot of the same prerequisites someone might need for a genetic counseling program? Were there things that you had to sort of maybe pick up your senior year or do later on?
Definitely. So a lot of the courses do overlap with genetic counseling programs. Basically, you need a very strong foundation in the sciences. Obviously, you need to take genetics. Um, the one big thing I would tell students that may not be offered as a class is just in general doing advocacy work. So when I was at WAC, I was a peer mentor. So I worked very closely with students, talking to them about transitioning to college and things like that. So that really helped me um, when applying to genetic counseling schools. I also did a lot of volunteer work with Crisis Text Line. So one thing I would just say is, in addition to that big course load, these programs look for a lot of volunteering, advocacy, crisis text lines, phone lines, anything along those lines. But yeah, as for course load, just the general biology recommended courses for pre-med all counted towards these programs. I think there may be one or two of the ones like extra stats classes and things along those lines, but overall, I would say so.
Okay. You gave a little advice for current students there. What might you tell a current student who's sort of interested in healthcare or a health profession of some sort, but not sure which specific field they want to pursue?
I would not be afraid to take the gap year or two. I know going into it, I was very nervous. My family was nervous. I feel like there could be sort of a stigma around taking a year or two off between programs. But personally, it really helped me to just sit down for a moment after I graduated, focus on really what I wanted to do, look into different options, and just explore. I think it, like I said, I thought it really helped me. Plus, my work I did after graduating really helped on my application. Um, like I said, I did genetics research in ALS. So that was a big selling point on my application. Also, again, I bulked up my hours when it came to volunteering, advocacy, all things that really helped my application. So just the students who I think are unsure of what they want to do in the health field, there's tons of like very niche fields out there. Um, I said not a lot of people know about genetic counseling, but I hope that's something someone would maybe look into in the future. It's a really great field. I think it combines counseling, so one-on-one person interactions with science heavy love. So if you love both of those things, I think that's a great field. And also just like not being afraid to look into other options and other job opportunities out there.
Sure. Is there anything else you want to share with us today?
I would just say if you're looking into applying to this field, don't be afraid to reach out because it is a smaller field compared to, say, maybe doctors, nurses, PAs, things along those lines. We're very, very open to talking about our field and sharing ways to get into programs. So again, if you're thinking about genetic counseling, please reach out to to me personally, to anyone else. If you look online at local genetic counselors, don't be afraid to reach out to them, especially with COVID and everything going on. I know more genetic counselors are open to doing phone interviews instead of like shadowing in person. So interviewing over the phone, such as just asking about their job, what they do on a daily basis, things along those lines. And also just helping you get into programs because the application process can be a little difficult to navigate. I know took a lot of research for me to navigate it. So
Yeah,
just asking for help is big.
what is that process like? I would assume there's not yet an application service for genetic counseling programs.
So we utilize the match program, which
Okay.
is what a lot of residency programs will use as well. So each school has their own application, their own things they or need and are necessary to apply. Some schools aren't doing the standardized testing anymore, some still are. So it's just a matter of seeing what the schools need, and then they send out interviews. So each schools will hold their own interview days, and then you interview with those schools. And then much like other matching programs, you rank the schools you interview at, and then the schools you interview at rank you. And then depending on how that ranking lines up will be determine what program you get into.
Okay. Yeah,
So it could be a little confusing to people who aren't familiar with it, and also very, very stressful trying to figure out what programs to rank and everything along those lines. But it does work out for the better in the end of the day. So.
that is useful insight. I think that's definitely a difference from how a lot of other, professional or grad programs operate. Yeah, you are more acting like the residency match rather than the school like the normal school application. So that's fascinating.
Yeah, and I know that was something I was not expecting when I went in to apply. So again, just I took time to research, figure out what that match program was like. And also I talked to other students who were also going through the application process. I know there's a lot of online groups and forums that are specifically aimed at helping students and talking to other students who are thinking about applying to genetic counseling programs. Also, I would just say if you're thinking about applying as well, don't be afraid if you don't get in the first time. I know tons of genetic counselors and genetic counselor students who applied more than once, and they got in the second time, third time. So don't be afraid that if this is truly something you want, don't get discouraged if you don't get in the first time.
Do you think is it that highly competitive right now? Or, I mean, I guess the question is it supply or demand, right? Is it that there just aren't that many programs yet, and so there's only so many spots each? Um,
Yeah, it's a little bit of both. I know I read a few studies before that said, and these statistics could be wrong, but genetic counseling programs are just as competitive, if not more, than med school, just because, again, the supply and demand. And I read another study that said, this is pre-COVID, for every genetic counseling student graduating, there's 7 open positions.
so the
So
number
there's
of
kind
programs
of
hasn't caught up to the professional demand. That's interesting.
correct. Yeah, so it's a very, very high demand field. So getting into the programs are very competitive. Um, I'm not sure of the exact number of programs there are at the moment. I want to say around 50, 60. They are growing. They just added 2 or 3 this year, but each program is very small. So they range in size to about 2 to 3 students to 20.
Right.
So
That's what
it
that
is
makes
a very competitive field to get into.
that makes sense for students to not be then discouraged if they don't get accepted. Sometimes it's just a numbers game.
It 100% is, and that's what I would stress as well, really looking at the schools. People think, oh, if I apply to a school with 20 open positions, it's a guarantee. No, because you have more people on that same mindset. So it's really just looking at what schools you think you have your best odds at, looking at what they require, and really taking advantage of those interview days if you do get any interviews.
Okay. Well, thanks so much, Shannon. I learned a lot. So I hope certainly that any of our students or anyone else who watches this will take away a lot of insight there, not only about the field of genetic counseling, but the particulars of applying and sort of the current environment of a growing field like this, and how it's, the number of programs has to sort of catch up, right, to the demand of the actual.
Yeah, no, and it's a great field. I learn something every day. I'm actually currently in a virtual conference or yearly conference. I'm in it right now. So I'm learning daily. There's so many different opportunities. I know personally I'm leaning towards prenatal or preconception, but I have roommates who are leaning towards neurology, cancer, basically anything you can think of in the medical field, you can be a genetic counselor for. So I think that's also something to keep in mind, that the possibilities really are endless once you get into the field. And there's so much you can learn about your genes, genetics, and how it affects everyone else.
Okay, great. Well, thank you, Shannon. And I wish you the best in completing the program, obviously, and then finding a position. Again, thanks so much.
Of course. Thank you.